I love them because
They're
there's,
the best in the world.
and the CHOP Hospital alone is best in the world, and that's why I fought to get here. And that's why, you do see Anna Marie, because I fought for hours to get her here. While she was...
And I'm not saying I'm saying that it's normal for you to be angry.
And you said there's no way to tell what time Christiana called this hospital? You said that yesterday when I asked you, can we find out what time Christiana called this hospital? You said there's no way of telling that.
I didn't say that to you.
Okay, well, is there a way to find out?
When they first made the call?
Yes.
You can, and that would be something you do with your lawyer when they go through the records. If it's in the records, it'll be found.
Just records can be changed easily.
We're not going to be changing any records. Why would we do that?
The fact that no one could figure out who the neurologist was who told us the information just leads me to believe someone.
We found the name, right?
Well, let's look at it.
It's a little hard to read, and I obviously haven't had a chance to try to search through all the neurology fellows, but we'll be able to find who it is.
You said you know about this hospital in Michigan that does the I'm sorry approach to malpractice, right?
I have heard of that, yeah.
It's very effective, right? Like,
yeah.
When people get angry, they're going to go harder, and I will never stop until I get to the bottom of what actually happened.
I'm not criticizing you for that, not at all.
And I just think it would be really wise if people would start, saying, look, we're not going to win here with this guy. He's going to get to the bottom of it. It would be really wise if you let Christiana know, or let the highest up people here know that talk to Christiana, that it's not going to stop. It's not just going to go away.
We don't really get into those sorts of problems of parents with other institutions. That's not our role. Our role is to take care of your baby when the baby comes here.
Well, tell me this. The sickest babies in Jefferson come to CHOP, right?
Some do, some don't.
What would prevent them from coming to CHOP?
They have a full scale system, so they have lots of sick babies that they don't send to us.
But the sickest ones that are the sickest she is would have come to CHOP, correct?
No, that's not correct. They keep many sick babies that never come to CHOP, very sick babies, even the sickest of the sick they keep. Okay. I expect she came to CHOP because you probably requested it, right? They're not in our system, and they have a full-scale system of their own. So we don't tend to get a lot of babies from Christiana, Jefferson, and DuPont because they're a separate system and a full system of their own.
So can you answer this? How come we had a meeting set up? I had requested for the neurologist, Dr. Cho, and the social worker to be at the meeting, and Cho, the neurologist, we couldn't figure out who it was until we dug in the book, and I'm the one who pointed out that it was in the book. But until then, we couldn't even figure out who he was. And Cho, first I was told he wasn't in the hospital, he was in his office somewhere else. And then I'm told he's in the hospital. How come he didn't come to the family meeting?
I don't know the answer to that. I don't know if he was asked.
Well,
I guess Monica was dealing with that, so I'd have to ask her.
Put it in the notes. So it's all in the notes. And I requested it with the nurse also. And the nurse knew why and everything.
Yeah,
I know that CHOP probably wants to just stay out of it, but the best thing is to do what's right.
Did you talk to Monica why Dr. Cho didn't come?
She knows why he didn't come. She knows what I think.
Did she say he refused to come?
No, that he's busy.
Well, that's very true. We all, when we're not working in the unit, have jobs in multiple different sites. So
But to go a whole week with requesting one doctor and one neurologist and one social worker, and all we got was a social worker.
I have no knowledge of what went out as far as requests. You had to talk to Monica about that because she was the one orchestrating that. When she asked me on Monday about the family meeting, I said the purpose of the family meeting is to sort out, what's going to happen with Alyssa and what our plans are for Alyssa. We don't need to have anybody else than me there. And so, that's what I told her. Now, if you had other conversations that you wanted Dr. Cho and and the
Yeah, I had
neurologist,
conversations
then
with
you
not
have
just
to-
Monica, nurses here also. It'll be in the notes, and I remember the nurse that specifically put it
yeah,
in.
all I'm saying is I don't know what request went to Dr. Cho.
Okay.
And
I was
A
told,
lot of the times too, I mean, if the attendings are here and they're covering not just her, but, 20 other patients, and there's an emergency or there's code or something like that, where they have to prioritize that, and if they can't make it, even if they have the full intention of making it.
yeah, well,
And it's all,
I
yeah.
don't think that's the case because I was told he would be here until the day I got
But if
here.
there's, I'm saying if there's an emergency where all of a sudden, oh my gosh, this
Oh,
needs
yeah.
an emergency, you know what I mean, on the unit, physically has to put that above a meeting.
So we really need to get Monica here and tell you whether she asked. But I feel like if you're gonna, I don't know.
I'm gonna get to the
I don't know
bottom
where
of
Dr.
what's
Cho
going
is
on.
today. If he hasn't been asked, we can ask him to come talk to you again. I don't think he's trying to avoid you.
I think he said something that when I told him I was seeking medical counsel, or not medical, but legal counsel,
Yeah.
the thing he said was pretty critical to what's going to happen with that. And I think he made a slip of tongue or whatever, but the neurologist said the exact same thing. And I'm sure the MRI is going to show the exact same thing. So that's why I want a copy of everyone who was in that meeting that read that MRI. I don't want to
That'll
go
all get-
against Chop, trust me.
No,
It's the last thing I
I
want to do.
understand. I don't feel like we did anything wrong. The best way for you to do that is to get the copy of the medical records, and then you'll have access to all that. I can try to look through when I have a chance. I don't know if it'll be today, to try to find if I can match that signature with one of the neurology fellows.
But it can't be that hard. Come on. I mean, he's under Bruce. His name's Misha, something like that. We know exactly what he looks like.
Do you know what my day is like when
Well, I
I'm
do
working in here?
understand. I do
So I have to
understand.
really prioritize taking care of babies and not dealing with the other things.
I do
like that.
understand.
So that's, I haven't tried to look. I have not done anything, but I will when I get a chance, if that's important for you, and I'll try to
Very
match
important.
that up.
That's why I've been
Yeah,
asking.
so it's going to take like probably half an hour of my time to try to find that, because there's no easy list of
Is there
other
anyone
fellows.
else like below you that can do that? Like, all right, let's see the neurologist list here. Okay.
No,
his
that's
name.
not our job, okay? I'll do it for you to just do it for you, but that's not anybody's job here.
Okay. Well, I do appreciate what you guys have done for Alyssa, because she wouldn't be here if it wasn't for the professional
I know that's
Yeah.
true, yeah,
she got here.
I know that's true. So, I have to go to a meeting now, and I will try to track that info down for you. If you wish to take her, I think it'd be best for us to just wait until we have
Yeah,
heard back
absolutely.
from the cardiologist and the ear people, but I feel perfectly comfortable with her going, tonight, later on today, once we had that happen.
Okay, well, we're not going to take her without everyone here saying thumbs up, good to go, 100% discharge. And we're not going to take her just because we're a little bit uncomfortable about something. We're not angry at Chop.
Yeah,
Just
no, I
some
know
of the
that.
things that are happening should have been handled a little bit more professional, like when I requested for the neurologist. I still can't get his name. You know what I mean? Like, I think that someone should just open the book and say, his name's Misha, whatever. There it is, done. It doesn't take that long. I
Well,
mean,
we found his name yesterday. I showed it to you, right?
yeah, but you couldn't read it.
Right. So, it's going to just take me a little bit of research to try to
So how
sort that
many
out.
fellows are under Bruce? Is he under Bruce or
I
not?
don't even know,
Don't even know.
but a ton.
A ton. Fellow neurologists
There's quite a few, yeah.
with
I
names
don't
that
know.
are unpronounceable.
The names.
Both first and last name are
I think if I take 45 minutes, I'll be able to find who this person was, no problem.
I think it would probably take like 2 minutes.
No, it'll take longer than that.
You
like,
couldn't just pull up the file on the computer?
If I did, I would have done that for you yesterday.
So that you couldn't just pull up his name?
No, there's nowhere that I could just pull up the names of all the neurology fellows now.
Well, not all of them, the one that dealt with her.
Well, I'm not sure I can fully read that spelling, so I just, you know,
Well, if I
I'm
can
gonna have
copy
to
down
get
the
them on
letters
this.
like M,